Alright guys, gonna call the meeting to order. It is 12:03. We get started with roll call. Mr. De Anda. Francis Pancho Averill. Guadalupe Ramirez.
Here, present.
Jorge Gonzalez.
Present.
Hector Alanis.
Here.
Myself, David Vasquez, present. Dr. Richard A. Chamberlain.
Present.
Looks like we got quorum, ladies and gentlemen. Any public comments?
No public comments.
Public comments, no public comments, great. We'll move on to the next item. Approval of minutes from the November 25th, 2024 Health and Wellness Subcommittee meeting. I'd like to entertain a motion to
I
approve.
move to have it approved.
Okay, repeat that.
Second.
Second. Okay. Discussion? All those in favor? Aye. Okay, motion carries. All right, moving on to the, item number 5, follow-up presentation by the Human Resources Director on unfunded liabilities and any other actions incident thereto.
Good afternoon, Chairperson and committee members. Management of the City of Laredo has been meeting on this topic on the unfunded liabilities and also for the pension systems. At this time, the City of Laredo will not pursue its request for the unfunded liabilities nor the pensions at this point. The city's opting to review how our city will progress in the next year. There's been some changes that the city has done to address the pension system, and also we'll continue to work with our consultant, our financial consultant, on how to address the OPEB, and at this point, the city will not pursue it.
Wow, okay. I'm sorry.
No, nothing, sorry.
So do we have that money available to,
That is at the discretion of the committee
yes,
as well,
I
and
think we should think to allocate that money that was requested to what we had intended, the expansion of this building.
So I move that we accept what the city's proposal.
So really quickly, I just wanna understand, just because there's been a lot of discussion around that. Are you at, privilege to kind of go in?
Point of order real quick. Already made a motion, so.
accept the motion and discussion.
Oh, okay, well, yeah, sorry, my bad. So,
Yeah.
we'll accept your motion,
Well,
motion, what,
we
can you
need a
repeat?
A motion is to accept what the city is recommending and not pursuing this as per their, what they found. Yeah.
Accept the just accept their,
And accept that
their
they're.
presentation that they are moving away from it?
Correct.
Yeah.
Okay.
You need a second, Councilor. Chair.
Yes, second, get a second?
You'll be.
Repeat that,
Yes.
second, okay. Discussion? Yeah. So that's really just,
So there were several factors. We went back and we spoke with management after our meetings here, and we also went back and shared with management what our consultant at that point had shared with us, and we also shared the information on the pension system. Once we took all that information together, the reason we were here was because our consultant had said that we need to put it on referendum. However, we learned through the consultant that in order for, there's areas of concern, we were not able to get a true definition of what that percentage should be or where we should be at. So we've been running our organization as such. What we're going to do in the next year, 2 years, we're going to be monitoring that to see, did it make an impact based on the changes with the fire pension system, based on our, the new hires that are coming into it, they're going to feed into this program. So we're going to be monitoring it with finance and HR, and we're all going to be looking at it at this point. We're going to do a closer study. We didn't feel that we had enough information to move forward and put it into the voters at this point. The numbers that we were coming up was between, I guess, 154 million. Should we go and ask for 5, 15, 20 million? That was the undetermined number. So in a year from come September, we're gonna know how we're doing as a fund at that point. And at this point, we don't have enough data to make that determination and be comfortable in saying, I recommend, or management saying, I recommend X amount of money. So we're just not at that point today. Unless Mr. Sparta, you recollect.
No, that's, this was part of the budget department, in talking to finance, our financial advisor and management, as Mr. Nathan mentioned. Our TMRS pension, is funded at 84%, our pension is about 60%, and the OPEB is the one that we're continuing to look at. That's the one that, we cannot get an actual amount of funding that we need to fund that one. One of the things that we were required to do is bring it to the board, and so that when we go out to the bond rating agencies, show that we're making an attempt in trying to address this. We are going to try to, fund this through our, either one, through our budgeting process on a year-to-year basis. And if we feel that we do need to come up with an amount that we can start funding moving forward, maybe do it on an annual, year basis. And in within the next couple of years, if we need to bring it back in our next referendum that we might have, then that would be another opportunity we would have to look at.
How does and I know the biggest concern was the fire pension, how does because the city's pension currently it's healthy, it's self-funded, but the fire pension, how is that going to be, worst case scenario, just in the event that it needed to be funded to that 80% that we had talked about to be compliant or to get that good rating, how would that get funded?
The city has been working diligently with the union and the fire pension for the last 8 years, more or less. So the city has contributed more money, as well as the firefighters themselves, as well as there has been adjustments to the benefits that we're getting. So this last year and a half, there were some items that were changed in the pension benefit that are gonna have an impact on it. And the fire pension does an actuarial study every 2 years. So we're scheduled to have one this year. That, in coupled with the really good returns we've had in the last couple of years, will have a positive impact on that. Once we get those studies, like Linda mentioned, around summertime next year, then we're gonna see where we're at, how much we're gonna move up, and then from there, we will continue to address it on a year-to-year basis, or when we have the open collective bargaining with the fire. But we're hoping that it is gonna have a positive impact in there. So this next year's actuaries are gonna give us a good, or see the results of the changes we've done so far.
Okay.
And if I may also add to that conversation, we're also gonna monitor the new hires that are coming in. They're anticipated as a result of the safety committee knew that on the main board. You're gonna see if that is passed, and by the board and then by the community, then that will address the 91, I think it's 91 positions that we're looking to hire. So once you get that new employee going into and feeding into a system, it's gonna grow that fund as well. So it's kind of determining, one, we didn't have enough data, two, we're gonna see how that hiring goes as a result of if it passes the bond referendum. So it's kind of all tied in together. So we're gonna be monitored from different angles just to see if we're gonna get the funding that we need in order for it to stay solid.
We did have 62 positions were added in this budget year. One, there were 24 that were added for the ARPA funding, and we are absorbing them this year 100%. And then we also added another academy of 38 that are gonna be funded through general fund. We had applied for a safer grant on that. Unfortunately, we did not get that grant. However, we were prepared to absorb those positions into our general fund. So the 62 positions are cadets that are coming in. They're gonna assist helping the funding, and they'll be in the system for another 20-25 years before they retire. That's a big impact as well.
Do you anticipate how many to retire within a year or two?
Actually, we do have estimates. We've had anywhere from 15. When we had the changes on our plan, we did have about 37 that retired because of the changes in the plan. I just had a conversation with the fire chief today that it looks like his anticipated numbers for this year are gonna be less. So he's looking at less retirees now that we kind of stabilized the changes in the pension. Okay. So I think we're gonna have probably half of what we projected. So that's also gonna help.
That's gonna help.
Yes.
On average, we have anywhere from 12 to about 18 firefighter retirees on average.
Okay.
But last year, because the plan did change, we had a huge influx, which was 37, almost unheard of. But because what did that do? It would raise the age for retirement
Right.
and also the cherry picking where they could have picked certain years to include the overtime and salary. The plan themselves opted to correct it, and they're not allowing that to happen, which is gonna impact the overall funding of the firefighter pension
Right.
system.
Oh, thank you.
Any other?
Call for the vote.
Yeah. So we've got a motion, we've got a second. All those in favor?
Aye.
Motion carries. Thank you all for your work on that. That was very informative. You know, it's really good to understand how all of this is working, and so it's a big deal. So thanks for everything that you're doing. All right, moving on to item 6, discussion with possible action on the Health and Wellness Subcommittee related items in the December 10th, 2024 bond referendum meeting, focusing on recommended projects and any other actions incident thereto.
If I may, Chairman, I'll go ahead and start us off. And as requested through previous meetings, it was identified that we do need to provide information to the bond committee at large regarding the decisions that were made amongst this group. So this is the first one. And so just, we're gonna give a quick recap. If there's something that the group members would like to remove, since this is very short on the pediatric hospital side, which is just the needs, and then ultimately the recap of what happened in our meeting. So just the background, right, 75% of children live more than 60 minutes from the pediatric hospital. Laredo is significantly underserved, and families often travel to San Antonio and beyond for care. Critical in emergency situations, these delays can result in poorer health outcomes. Pediatricians, there's 4,096 to every one pediatrician in Laredo. In primary care, there is 3,290 for every one in Laredo.
Can we go back to that one really quickly? So, one pediatrician for every 4,000?
Correct.
Okay.
Can you also add Corpus on that second bullet point where it says, and families often travel to San Antonio? We go to Corpus. Do we want to add Corpus?
Yes, I mean, that would, we can absolutely do that.
So it doesn't look like they're all going that way.
And this,
So, yeah, everywhere, actually, right, even to the valley.
and this data that, these numbers are from, are.
So the primary care is from the HMA. The HMA assessment did not provide us an actual ratio, so we took that into an account ourselves. Surveyed the Texas Medical Licensing Board of the active licensures that were here in the city of Laredo, and then filtered out those that were specific to Driscoll that do just come in on a one-time-a-week basis. And that's where we were able to come up with this ratio as well.
Real quick too, when we jump into the third and fourth and fifth bullet points there, are we talking about overall general physicians, or are we talking just about the pediatricians?
Pediatricians.
The primary care physicians, that's the other one. Wait,
Yeah.
It's another.
yeah. That's why that number drops, because there's more primary care physicians than there is pediatricians.
So that's 3,290 cases per physician?
Patients per physician.
Patients per physician.
Moving on, just to recap on the discussion that happened, the CEO of Laredo Medical Center highlighted a significant underutilization of resources, noting that out of the 29 pediatric beds available, only 2 are typically in use on a busy day. The CEO of Doctors Hospital noted that they consistently have an average of 2.4 pediatric patients, reflecting the ongoing but modest demand for pediatric care at their facility. Between both hospitals, even on a busy day, only 4 pediatric beds are typically occupied, highlighting the overall low demand for pediatric inpatient care in our area. And on November 25th, 2024, the Health and Wellness Subcommittee decided not to support using bond funds for the construction of a pediatric hospital. Are we okay with that?
Mm-hmm.
So this is a presentation that we'll show tomorrow as well.
Okay.
On the public health side, we made an update to the title of the presentation specifically to public health, which health is wealth, securing Laredo's future through public health. And we really wanted to give a little bit more of a value and meaning, and ultimately break out of the glass walls that we have here at public health. So So our public health department is more than birth certificates, immunizations, and WIC services, which is what we're classically known for. It is a cornerstone of a healthier Laredo. Since 2019, we've emphasized our role as proactive stewards of community health, focused on preventing chronic diseases and improving the well-being of our residents. As Laredo grows, so does its health challenges. We leverage grants and city resources to implement programs that save lives, reduce healthcare costs, and support the overall quality of life in our community. A healthy population leads to stronger families, a more productive workforce, and a thriving local economy, proving that health is wealth, not just for individuals, but for all Laredo. To meet these growing needs, we must expand our capacity to intervene and protect public health. Investing into our growth ensures healthier lives, stronger communities, and a brighter future for everyone. This is what was already discussed at the previous meeting, when we first rolled this out on November 14th, which is the public health challenges, which include chronic disease burden, mental health care and behavioral health care needs, substance use and addiction treatment gaps, health professions shortage and medically underserved area designation, high insured and underinsured populations, and then of course social determinants of health and access barriers. We really wanted to highlight on the prevalence of chronic disease here in Laredo, so we can build the narrative on why it's extremely important to invest into public health. So as you can see here, we do have diabetes, high blood pressure, high cholesterol, and obesity. And I will highlight for the bond committee members, and of course our subcommittee members here, this is at the, where my cursor is, this is at the very high end, this is the national average, and this is at the very low end. And so for diabetes, our whole city is way over the national average. We are double the amount. So that's on the diabetes side. On our high blood pressure side, you can see that we have several census tracts, and we do have 69 census tracts in the city of Laredo. And we are, I can safely say that on the high blood pressure side, we are probably at 50% of every census tract has above the average of the state, at the federal level. So these are all taken from CDC places, so this is federal information that is, that we're utilizing to demonstrate the current status of health in Laredo. Same thing on high cholesterol, as you can see, it is all in red. We are at the extreme high rates, and there is even some points there where I give information as to specific census tracts. So there are some census tracts with diabetes that are as high as 28% of the population that lives in the census tract. With high cholesterol, we have some that are at 47%. I mean, that's 1 in 2 people have extremely high cholesterol, blood pressure, obesity. So this is highlighting the current health status of our community. To add a little bit more, we included stroke, we included depression, we included COPD, and we included heart disease. And you can see that our community, based off of the higher end of that legend, we're not in good health status in the city of Laredo. This is very, very telling, very powerful, and a call to action that is needed to invest into public health.
Just one comment. The national average is bad itself. We're living in an epidemic, so we don't want to be international average. We want to be below.
Correct.
Are we already at the national, like we're surpassing?
Oh, yes.
So for diabetes, on the national average, which is already high, as Dr. Sepa is mentioning, we are double that already as a city. But then of course we do have some census tracts who are triple that. And that is very concerning for us.
We need to move. So is it all because of diet? Is the underlying factor the
Lifestyle.
Lifestyle.
There are some genetic factors, and of course epigenetics, environmental factors involved, but it is lifestyle at the core that needs to be focused on. And
We love fatness, we love to drink,
And not exercise.
and we
And
don't
not
like
exercise.
exercise.
Yes.
and not deal with our stress and not get restorative sleep. We can go on and on.
Yes.
Uh-huh.
Okay.
So, these are all, we're comparing to, national statistics. Is there a way to compare to, state statistics?
We can definitely look into that. CDC places can give us some information regarding the state, but maybe not at the granular level that we're seeing here, because this data provided by CDC places is specific to census tracts.
Okay.
Can you talk about the depression?
So on the depression, there is an estimated prevalence of, so in this specific census tract, We did see, which is the census tract of 48479, which is in central Laredo. There was a depression with a prevalence of 24, almost a quarter of the population is experiencing some form of depression, which is above the national average at 23.2%. But as mentioned by Dr. Selva, that's the national average. That doesn't mean that is in good health standing, the national average. We are beyond that regarding depression in our community, but that is also tied into several factors such as these chronic diseases. The burden of chronic disease does increase the level of depression, aside from also the social determinants of health that add to depression.
So the highest concentration is Central Laredo?
Central Laredo and South Laredo, Central and South. And to develop that a little bit more, we wanted to actually get into the costs that are associated locally with the burden of chronic disease in our community. So we have direct costs. For those who are not aware, those are the immediate medical expenses, including hospital visits, medications, and equipment, and the indirect costs, which are the broader economic losses like absenteeism, reduced productivity, and caregiving burdens. So the combined economic burden of diabetes, hypertension, and obesity in Laredo is conservatively estimated at $854 million to $2 billion annually. This includes the direct costs and the indirect costs. And these are the chronic conditions perpetuate poverty cycles affecting workers, businesses, and families. And so we really wanted to hone in on this, and I did want to make a disclaimer that when we were adjusting for the costs here in Laredo, we had to look at the national level. And I'm going to pass it over to Angel so he can explain it just a little bit better for me.
Yes, so we looked at readily available resources, which is American Diabetes Association, American Heart Association, and the Milton Institute. They provided a study. Some of them are based on 2018, 2019, so this is a very conservative. It's actually looks like it's more. And we based ourselves from the national average cost, and then we brought it down to our average in Laredo, which is about $31 an hour is the national average. We brought it down with a $21 an hour to adjust to our costs. And we assumed a 30% comorbidity rate among the existing conditions. So we just thought we'd share that. A deeper dive is required to get actual costs and to factor in inflation and the rising healthcare costs.
So as mentioned, this is a conservative, as this was taken from previous year cycles and not up to date with our current healthcare situation in the United States. But this to us was very eye-opening to see that there is $1.2 billion on the conservative end that is being sucked out of the system, right, because of the high chronic disease prevalence. So we want to make sure that going forward, we are going to be tackling these root cause situations as public health can take that role with an expansion of our infrastructure, which ultimately will lead to additional programs coming into the city of Laredo. And so just to recap, the Laredo Public Health Department is requesting $60 million. Of course, now knowing that we are not going to be pursuing the unfunded liabilities with our HR department, we are going to be kindly making a request to increase that, and that's due to the inflation costs or the at every annual rate if we don't build from one day to the next. So that is taken into account, and we'll get to that. Then we'll request that at the end of the presentation. So there was $60 million that was originally identified on the 14th of November. We will be expanding to 145,000 square feet. We're already working on a structural assessment, so we do have 1 foot in the door for this to start to unravel itself. And just to give some more feedback regarding the number of grants that we did apply to this year, we applied to 18. We are about 50% rate success rate, and we've already brought in $10 million this year. So that's just demonstrating that we're looking for these awards. We just don't have the space here to continue to accommodate them. And we don't want space to be an issue as well. And so here's the really interesting part about what we are talking about. So investing into the expansion of the public health department offers us a significant return on investment by reducing the prevalence of chronic diseases like diabetes. A modest reduction of 1 to 2% in diabetes could eliminate 400 to 800 cases annually, saving the community between $7 to $14 million per year in healthcare and productivity costs. This proactive investment would allow the $60 million bond to pay for itself within 4 to 8 years, demonstrating both economic and public health benefits. This is just diabetes. We are not taking account of hypertension, hyperlipidemia, COPD. So as we're able to attack lifestyle medicine alterations in the community by investing into public health, we'll see a significant reduction. So I can throw out a number just real quick. Right now, with our current chronic disease prevention and diabetes prevention programs, we are seeing anywhere between 150 and 200 patients on an annual basis. We are already planning to increase that to turn that team into 6 with already existing funding. So we'll turn that into 6. So we will basically quadruple that amount of persons, the lives that we are touching, to be able to tap into this. And that's gonna happen regardless of the bond referendum goes through. We're gonna start that actually as of next year because we're seeing that we can make this type of impact. And this is just on the diabetes side. And so as we continue to really invest into the lifestyle medicine practice, which is focusing on sleep, focusing on stress, focusing on nutrition, focusing on physical activity, focusing on those social connections, and ultimately eliminating those risky substances, we can see and have a healthier Laredo. Will we have that tomorrow? Unfortunately not, but it'll be a work in progress. And we do know that also as public health, we do need to inject ourselves into the school systems as well and make sure that health is at the core of what they are learning since kindergarten, which I can recall back in the day when I was in school, there was a health component, and there truly isn't any health component anymore, not until you get to take an elective in middle school and in high school, and that's if you choose to take it as well.
With all the information you just shared with us right now, the importance of the money that you're asking for, it's not necessarily tied up to the number of people that you need to service all these individuals. It's having the facilities and the space
Correct.
to be able to provide, double or triple the service that you guys are
Correct.
providing right now. Right?
Yes, sir.
And I think that'll be important to emphasize in front of the committee when we're up there tomorrow.
Dr. Chairman, are they gonna teach nutrition, and do they teach nutrition in middle school?
I'm actively exploring that right now. I'm very fortunate to be very close to the legal team at UISD, and I'm going to somewhat start injecting ourselves into their curriculum to see what TEA allows. So I don't know exactly what they're learning at the middle school level. I just know that it's slim to none at the elementary and middle school level.
Because we're not taught how to eat, we're not taught how to look at labels, we're not taught, I mean, you look at the majority of the stuff in the foods they're poisoning us, and it's starting to come out more.
And physical activity has been eliminated,
But nutrition, nobody ever taught us anything about nutrition.
And that's where it starts. I mean, if mom and dad aren't able to do that for the kids, then society can definitely step in and help educate to elevate their level of awareness regarding their outcomes as they age into their adulthood.
Do we have a dietitian to offer the services right now?
We have dietitians here. They are part of the WIC program, so they are specific with blinders to the WIC program. Unfortunately, we would like to have them for the community at large.
Yes.
And that's something that can be discussed as we go into the future and look for additional awards, or even on the general fund side as time goes on.
Yeah, because a lot of times when you go to the doctor, that happened to me. Or you're pre-diabetic, we can give you some medication. I said, no medication. I want to consult a dietitian and I'll get on a diet myself. Because right away they want to give you the medicine. And so they need to emphasize that a lot of that can be controlled through a diet, through a dietitian that shows you more what to eat. And, if the exercise not.
Well, we never want to discredit the medication because you might need it immediately to bring down your numbers, but then you can definitely jump onto the lifestyle modification trends to either reduce the dosage or
Yes.
eliminate the medication indefinitely.
Yes, but I think as consulting a dietitian at large to everyone, I think it would be a great benefit.
Yes, ma'am.
We do have several health educators, and they know how to teach diabetes prevention.
Yes,
And ourselves, we are lifestyle medicine providers. And I have had patients coming to the clinic, and I was able to revert prediabetes
yes,
with lifestyle changes. So that's possible. We just need to elevate the program and have more resources to offer that.
yes.
If I can interject
Yes.
on that, good afternoon, everyone. I think it's important, yes, we are very fortunate that we have credentialed individuals as registered dietitians for our WIC program, but the core of some of our programmatic outreach that focuses on education and prevention of diabetes and hypertension. I mean, I'm a product of just in hearing our outreach team, our health educators about lifestyle changes, about diet, about exercise, about those really small changes in our day-to-day. I mean, to revert diabetes, revert hypertension, or when you're at risk of that. And we've seen great success in the program that Dr. Chamberlain mentioned. We're looking to expand, regardless, we'll figure out where we place them. We have very willing individuals also, that it's like if we need to double up offices or things like that, we kind of find a solution. But we have a vision to provide services that Laredo deserves.
Yes.
And at the caliber that Laredo deserves. And we're fortunate that we do have the pool of professionals that can provide those services.
Thank you.
Thank you. And so with that then comes in the project timeline for the expansion. And in FY '26 would be the design and survey, which would include the community, and we are proposing the clinical center / research center. That would be 15,000 square feet, which would be here on the south side of our campus, and we'll show a map right now just to remind the group. And that is typically 15% of the cost for the design and research, which would be 3.1 million. And then for the additional floor, that would be 25,000 square feet, and that would be 4.8 million. Then we would start construction in FY '27 for the 15,000 square foot clinical center / research center. And that at current market, since we have already had discussions with our city engineer, I had the opportunity to sit in right now, last week on our veterinary clinic that is being built as well, and then knowing the numbers from the new fire extension for their maintenance building that they're putting up on North McPherson, we were able to identify that right now for a public health expansion, it would be $750 a square foot. And so that's $11.2 million. We're accounting for inflation, if this were to start in 3 years from now, that would put us at 882 and at $13.3 million. And so we did include a project contingency into that, and that is not supposed to be 3.9, it's 1.2 million. The rest of that 3.9 should be on FY '28, which would include the remodel of the first and second floor at $400 a square foot for 10 million, then the construction of the third floor at 25,000 square feet of and that's a new construction in that time, so that's $850 a square foot for 21.2 million, and then accounting for the inflation at that time as well, jumping that up to $1,000 a square foot in FY '28, and that would be 26 million. So all in all, we did originally ask for $60 million, but because of the actual deeper dive into detail that we were able to conduct over the last couple of weeks, and relying on the expertise of our city staff and external partners that I've been able to sit into, we would like to request an additional $8 million, or just round it out to $9 million. So that way we can include the inflation costs and ultimately have that $69 million for contingency and inflation for this project. So that would be a breakdown of the current request, which at today's market, as mentioned, would be 61.1 million, and in the inflated market to the future at 68.9 million. We would be requesting to buy a mammogram machine, a new X-ray machine for our TB clinic, autoclaves, laboratory equipment for our BSL 2 and 3, and then of course to ensure that these are able to be off-grid, we included generators for the clinic expansion and the main campus expansion as well.
Dr. Chairman.
Yes, sir.
Initially, it was 80 million, it was 8 million for the Hamilton, 60 here, that's 68, so there's still $12 million that we can.
Correct.
Why are you asking for 9? Why don't we just do the 12 million allocated?
Sure, may I make a comment on that?
Yeah.
Just a point of clarification, again, the allotted money that was initially in there was just a number that was put in to compile that first presentation that was done by management.
Right.
There's no money out right now.
No.
So the committee is gonna come up with a recommendation, and that recommendation is gonna go forward to the main committee for their approval. So whatever those amounts are is what's gonna go to the public, but there was no original allotment of money.
If you wanted to go to 100 million, we can go to 100 million,
That's
but.
it, I guess the point
Just
is,
looking at
yeah, I mean, the bigger the number we have in the final amount that the main committee is gonna recommend is gonna have an impact on the voters when they look at it. So,
You're right.
as long as we have something that is workable and can accomplish the task, I would say try to go with that number, not necessarily go over that.
For Dr. Chamberlain, for staffing, so for example, finding an X-ray tech, some of these are kind of hard.
We have them on board already, they're part of our, like, all this is already part of our system, we're just enhancing it.
Okay. The same thing with all your labs and, so you staffing, you're good on staffing?
I mean, we would like to increase to be able to further expand on the accessibility to the community. But staffing right now, we are able to accommodate. The situation right now is that we have staff on top of staff already here.
Right.
And can I make an additional comment? Regarding laboratory equipment, a lot of that requires upgrade. We, of course, have run maintenance schedules on that, but, I mean, you're talking about some equipment that's already upwards of 10, 12, 15 years old that requires replacement. So that's what's in consideration, not only the expansion, the X-ray machine, I wanna say it was upgraded 2012, so we're
Yeah,
looking at.
that's
The equipment that we have here is all part of the expansion, Dr. Jim, correct?
Correct.
There is gonna be another component of the MNO side to actually, for the expansion, which is maybe custodians, additional funding for
Groundskeepers.
groundskeepers and all that. I don't know if you have a slide on that.
I don't have a slide on that, but we do have all the information.
Yeah, I think it would be prevalent to have it in there, because I know that when Fire made the presentation, there was the MNO impact, so it will be that 68 potential referendum that will go out, but there will be an impact on the MNO side as well, the maintenance and operation, which is impacted by general fund on some of this, unless there is a grants that are gonna be subsidizing or helping this program.
And ultimately, over the FY 26, 27, 28, 29 year, it's at $3.2 million on the MNO side.
Increase or?
Increase.
Because of these additional monies that we're gonna have to fund.
And of course, but that's why you're continuing to working with the grants to be able to help, offset that, right? I also want to, once again, if there's any information that you can provide regarding the construction cost of being so high, I recommend that you provide that information, because when you bring this topic or this issue regarding the cost, per square feet of, not just a renovation, but, putting a new building, the average person is not gonna understand, why, okay, so our houses are $175 a square feet, A commercial building, maybe 260, but now we're talking about $750 and $800, $900 a square feet, and this is not including the equipment, correct? So that I think is gonna be a challenge. So we have to provide some information that's gonna help justify that cost.
And of course, between this group here, we do know that since we are a government organization and through our RFP process, that's also where those additional costs are thrown in. And we'll try our absolute best to help bridge that barrier, that gap of why is it so expensive, because I'm asking the same questions as a taxpayer too. But we will have our city engineer, Mr. Chavez, there present as well to be able to validate these recent bids and ultimately awards that have already been executed with these new builds that are happening.
Because,
Sorry, go ahead.
because I think that as a taxpayer, if you say, well, we need 69 million, and you send it out for bid, 69 is available, so we'll spend 69. You know, I think that the bidders are gonna go and bid whatever money is available. As a regular person, I would say that's too expensive, you know, because like Hector was saying, the cost even of commercial is like $250, $275 to build a commercial building with all the metal and concrete and everything that goes in, the electrical, the MIT, all of that. So
This is 2020.
I think $1,000 a square foot is pretty expensive.
I'm in agreement with you.
So we need to make sure that you
Absolutely.
sell it to the taxpayers at 1,000 square foot.
Yes, ma'am, and that is definitely going to be a challenge for the group.
Yes.
But it is something that we do need to come back to, as mentioned, for those direct and indirect costs that
They
are
justify.
are being observed in our community at the $1.2 billion mark, and we need to make a dent into that. And the way we can is at the public health level, since public health is, of course, reactive to emergency situations, but
Yes.
public health is the proactive approach to make sure we don't have the disease prevalence that we are seeing right now in our community.
This is good.
But this is I don't have a copy of this, but I will make sure
But
that
this
we
is
get
good,
it
yeah.
all. But
Would
that
you
is
please-
2021 non-governmental organizations. Just so you can take a look, and I'll go ahead and make sure that we do get copies.
And so when you get to the governmental institution, it's a bit higher.
Yes, always,
Can you go back to the previous?
yes.
Can you go back to the previous slide? And this is just a one before that one. So my only suggestion here would be to bullet this out, because this is super, like, this is critical right here, because your ROI is super important data right here.
And
So
that's
I
just
would-
on one chronic disease.
Right, and I would just so that the folks seeing this at the meeting, I think the presentation altogether it's really good. But I think on this part, because it's sort of your money shot, right? You know, bullet it out so that way it's black and white, very easy to read for the folks in the crowd that don't understand health, right? Like,
So
this
you're
is-
talking about maybe just start off with the key needs addressed
Well-
and put 1, 2, 3, return on investment, and then use one extra slide to put the bullet points on each one.
or just even this, just.
But that's kind of small. That's the reason I'm saying, you know, if you could.
Yeah, so like, for example, like, take that modest reduction, 1 to 2% in just diabetes cases, like, that's a bullet, right? And then the other would be, savings of, or, let's see, community between 7.4 million, 1429, healthcare. So right there, the savings, right, we would save between $7 to $14 million. And then the third bullet would be, this bond would pay for itself within 4 to 2 years. I like that, those are key points, and then just remove all the rest of it. That's just me putting my 2 cents into this presentation, because I think it's great all around. The data tells a story, and then boom, here, this is what's gonna happen once we pass this bond. So, that's just mine. Is there any other discussion, questions on the presentation.
So you need a motion to change our,
Yes, so I just wanted to show you all where this was going to occur. Of course, it'd be moving up here on our campus to a third floor, adding that additional floor, rather not moving up. And then, of course, where you see those buildings down on the south side of our campus, that is City of Laredo property. You might see there's some modular buildings there, they are no longer there. We had terminated a lease, or of course it wasn't terminated, it was an agreed upon end of lease with Webb County, and that building is no longer there. So all that property that you see there can accommodate a 15,000 square foot building, which would be our clinical operations. Right now, our clinical operation does not have adequate accessibility and flow to ensure that you don't lose people when you can get them through all the services that Laredo Public Health has, with the expansion of additional space to accommodate additional providers, and then ultimately that research component that we, as a academic public health institution accredited by the Public Health Foundation, want to continue to expand our footprint there. Due to the high prevalence of chronic disease, we firmly believe that universities from across the United States would want to put their toe into the pond, contribute to the literature, but ultimately elevate the health status here in Laredo. And so with that, we do want to kindly request, by the form of a motion from the group, to edit the $60 million that was approved for consideration on November 14th to the 69, and if we want to round it out to the 70, that would be absolutely wonderful to round it out to 70.
I move that we round it up to 70, because it's 69.8.
Yeah,
then
70.
70 million. That's my
70,
motion.
no?
Yeah.
70 million.
70 million.
I'll second.
Right,
So we're increasing the,
Just based on all the stuff you showed us and the costs and whatever, so.
increase the.
I would just, we have a second from Hector. I would just ask everybody, just so for what, going back to what you said earlier, if you'd like to amend your motion, just encourage you to do the whole 12 million. That way we just.
We still have community
So,
development on the property.
Well,
We
they're
have
already-
an ask. We have another ask,
You have another ask?
yes.
Oh, didn't know that.
I move
Yeah,
that
I
we
mean,
All right, well,
and
then
and we have, I mean, look, you know, honestly, I mean, you can, if we're thinking that way, hey, well, let's ask for 100 million. I mean, we need to just, we need to be fiduciaries of the taxpayer. And we, just because there's, you know, this is still gonna go to a bond, and that's part of the problem. When we get a little bit, I'm not, well, it's, I hate to use the word greedy, but we ask for too much and we don't get anything. So we have to, based on the information that's been presented, you know, this is how much money they feel like they need, and
That's why I say
just do
70.
that. I mean, why are we gonna ask for another 12 million and another 10 million? And if the presentation that's been provided started out with 60 million, now we're adding another 10 to allocate for any increases in inflation. And of course, this project has to be done within 6 years, am I correct? Within 6 years. If it doesn't happen in 6 years, we lose money. So, and we also know that if we wait 4 or 5 years, this $70 million is gonna be $100 million.
Yeah.
We all know that. And so, then there's gonna have to be another bond, or you're only gonna be able to build
Half.
3/4 or half of what, you know, was planned. So I mean, that's, and the average person doesn't, you know, the average person doesn't understand that, the taxpayer doesn't understand that, and that's one of the reasons why they don't trust, you know, what we're trying to do.
I think that we stay at 70 because that's what we can justify, you know?
Alright, very good then. The motion is to, increase the ask from 60 to 70 million. There's a second on the floor. All those in favor?
Aye.
Aye. Alright, motion carries.
Thank you.
Moving on to.
Okay, under the same, item, I would like to just discuss what I'll be presenting to the bond, full committee. So I know, we spoke about the numbers again, and there was some concern about, you know, the asking 8 million. We did add, in looking at it, we did wanna include a contingency, which we hadn't. which could cause for inflation or any other unforeseen construction, right? This is rehab, but you can still get, you know, surprises. And then we also wanted to add another $1 million for professional services. We were hoping to do professional services before we got to the construction part of it, but I think at this time, adding it to this bond will allow us to also, use some of this, planning, design, any, additional environmental, consultants that we might need to do. I don't foresee too much structural, request, cause the building is, has been assessed, but we might wanna, you know, add some of that. So again, so we are gonna be requesting from the subcommittee if you will agree to increase our 8 million to 10 million.
Okay.
Is a presentation, well, I'm sorry. Do we have a motion, or can we have a discussion before the motion?
I'm
Do you
a
have
part of
questions?
that bond, of that board that owns the Hamilton, but I was told that I could vote. I don't have a conflict, but, I know what goes on there or whatever, and it needs all of that 10 million or more, based on how old that building is and the tenants that are there, the elderly or whatever, so. It's a
Do you
long-
wanna put them, do you wanna put a motion?
I'll move, if it doesn't look like a conflict, I'll move that we change it from 8 million to 10.
Okay, there's a motion from Jorge. Is there a second? Okay, Lupita, second.
Let me just write this real quick,
So while you're writing that down, really quickly, I just wanna add to the building itself. If the building was to get sold, the value of that building surpasses this amount. It's way more. And
Way
so it's an asset actually for the city. It's a property, it generates revenue. I think this is an easy ask, in my opinion. That's my thought on that.
Yeah, and that's why us as a board owning that want to transfer it over to the city, because the city can take that, get that value, and
It becomes an income generating property.
it's a win-win for the city and for our board.
The 1 million for professional services, what professional services did you mention, I'm sorry?
So we will definitely be bringing on board a consultant, that can help us with any of the architectural, the, structural, if there's any structural, items that are needed, all the MEP, like the, mechanical, electrical, plumbing, we will get a consultant to help us basically design the changes that we need to do.
Okay,
So
so that counts with, when you do all your plans.
Correct, yes, basically, the consultant will help us develop those plans in a paper format that
And
will be.
the engineer would do that, but separate, you would have the engineer doing all those plans?
So we always consult external, engineering, architectural, all that consulting is done on an exterior, external
Okay.
process.
But they're not the ones actually doing all the plans for you?
Yes, those are, yes, I would be hiring a team to develop a plan, all the set of plans that will go out for bid for a contractor, correct?
For the general
So it's like a
contractor,
phased
okay.
project, yes, so you
Yes.
plan it, you design it,
Yes,
and
it
then,
goes out for
and then I
bids.
go out for bid, correct?
Yes, okay.
Yes. Yeah, so it's never the same party that constructs it, well,
No, no,
in this
I
case, it won't be the
understand.
one that designs it,
I-
yes.
And so, for this particular cost, you're increasing it by $1 million?
I hadn't had any professional service added, so I just added $1 million. Now, these are just our preliminary numbers, again, doesn't mean I'll put the whole million. You know, what we do for professional services, we go out for RFPs. So let's say my RFPs for these consulting services ends up being less than 1 million, I can use that for any other line item. So this is not set, like the line items are not gonna be set, this is just a projection, an estimate, an approximation of what we feel these line items will cost.
Right, so I'm just, look, and this is what I'm trying to do. We're gonna present this to the bond referendum committee tomorrow,
Correct.
okay? I'm in there, so is David, and then we have 3 other chairs in there. And so the other 3 chairs, they're gonna be asking questions, they're gonna be nitpicking. So they're gonna tell you mean to tell me you're gonna pay $1 million for someone to come and build you the plans and all that, to do all the construction. And so they're gonna be asking questions, so be ready to answer those questions, because they're gonna be nitpicking.
Yes,
How
and
you pay?
usually, and I guess now I understand where the question's coming from. So usually, any project, 10% is what you pay for any
Right.
professional services. That's how we estimate this number of being at $1 million.
Okay, I understand that too, and then we'll ask, I'll try to get some information on the other 1 million. But I guess my question in trying to understand this is why didn't we put that number before, when you proposed the $8 million?
We were being very conservative with the 8, and we were just, really looking at the construction side of it. And we estimated that some of that professional services, maybe we could find other sources to pay for it. I mean, it was gonna be needed, but I could have, we were trying to see if there was other services, other available funding, but at this time, I don't think there's any other available funding, so that's why we decided to put it back into the bond. We were trying to not put it as part of the bond, I guess that's the answer.
Okay, and the other 1 million?
Oh, that's just a contingency, so we hadn't added, and I know there was some talk about inflation, if our numbers are just estimates, you know, so we just, contingencies are just a part of.
And so is it
So
on
number
there?
one-
It's
Yeah, so number
It's at
one
the
is
very top.
contingency,
Okay. All right, got it.
and then number
All right.
24 is professional services.
I see.
And sorry, and I
See, I
didn't
can't see
copies
that,
for you all.
I can't see that small, that's why.
I know, it's just that small.
Did you have any other items or items of discussion?
Yes, so we got the contingencies at the very top, and then we have the professional services.
Yes.
At the very bottom,
Right.
for a total of 10 million, which increases it from 8 to 10. Okay? Got it.
Any other questions? Okay, so I have a second, I have a motion and a second. All those in favor to,
Aye.
And then
raise from 8 to 10 million from the, real estate department?
Aye.
All those in favor?
Aye.
Alright, motion carries. We are going to just open discussion.
And if I may, there is a requirement for one more meeting just to approve the meeting minutes from this meeting if there's no additional discussion that needs to
You
happen.
need that?
I was told by Mario.
Yes.
I would like to propose that, and then I'll get with you all in an email. I don't want you all to figure that out. I'm gonna confirm it also with the city secretary, so I can have it in writing from him saying that we have to. And if not, then I will let you all know that as well.
Okay.
All right, so then the question is, tomorrow we have bond referendum for the presentation. With this last detail we're just talking about, are we gonna be able to present?
Yeah.
Okay, so we can have this approval after the bond presentation?
Of the minutes, and the minutes are completely different from the action that's already been taken from the committee.
Understood.
Oh, that's right, yes, it's like a city council meeting,
Yeah.
we take action.
So you just let us know by email.
Yeah,
Yeah.
yeah,
We just need to approve today's minutes.
today's minutes of the next meeting, yeah.
I would say, is everybody ready for next week?
Well, I think, he's gonna check into, because I don't think we can
But,
put that.
just so we know though, just so Dr. Chamberlain has an idea,
What day?
if we need to, I don't know, Monday at this time?
And honestly, it would be a 15-minute hello, have a wonderful holiday season.
Yes. I would say let's do it virtually, but it has to be in person, sorry guys.
Yes, so, yes, I would be available.
Monday,
I can't go.
you can't, Tuesday? Tuesday lunch?
Tuesday the 17th, yes, I'm available.
We just need four days?
Oh,
For
3 days.
members,
No, but, I mean, how many days notice do we need for the meeting?
72 hours.
So can we do it this week?
Yeah, you can, absolutely.
What day?
It would be Friday.
I'm open,
Yes.
Friday I'm not available.
Okay. Alright, so that's one, George?
Friday?
Yeah. We can just leave it till Monday. You're available on
Okay,
Monday?
right.
Yes, we
And
don't
you're
go
available on
over
Monday?
And George is not available.
Oh, I can do Friday, I can't do Monday.
You can't do Monday, okay.
And you have two other board members, two other committee
That's the-
members that are here.
Mr. De Anda
Yeah,
and
sure.
Mastro, no.
Well, are you available Friday?
No.
Okay, so then Monday.
Monday,
You
no,
might do
you
it
can't?
Monday. I'll try to make,
And if not, we just need to make
I'll try to
sure,
ping
Oh.
we just need to
Mastro.
make sure.
No,
budget-
Okay, take that back, I'm not available Monday. Or Friday,
Tuesday, Monday.
Tuesday.
I'm available Tuesday.
I can do Tuesday.
Tuesday?
Yeah, we'll just shoot for Tuesday.
Okay, Tuesday noon? Alright, works. Excellent. Alright, so with that,
We need,
motion
yeah,
Motion to
Motion
adjourn.
to adjourn.
motion to adjourn.
wait, we need a motion to set up the next meeting, or no?
I think that would be safest to.
So yeah, we'll entertain a motion to task Dr. Chamberlain for the next meeting.
So moved.
Walker, motion?
Tuesday,
Discussion?
Tuesday, December the 17th at 12.
Tuesday, December 17th. Same place.
Yes.
Second by Lupita, discussion? None, all those in favor?
Aye.
Aye. Alright, I'll also take a motion to adjourn.
So moved.
Alright, motion to adjourn, Walker, and a second?
I'll do the second.
Alright, second by Hector, all discussion, all in favor? Aye. Meeting adjourned, 1:04.